what is diabetes, and is type 2 diabetes preventable to begin with?
Absolutely. So with the whole condition in itself known as diabetes, Kathy, it's a broad spectrum of conditions that are impacting different areas of the body. You'll often hear what's become sort of synonymous with diabetes, so this ominous octet of conditions. It impacts, areas of the body, the endocrine system, which most people are very well familiar with. But also, we've been finding with the advent of much more current research that's been going on in the last few years that diabetes impacts other areas of the body, the heart, and all of the cardiovascular infrastructure of the body in general, the nervous system and things that affect patients' eyes and other areas of their body that are innervated. So it's really a multi-faceted condition. It really can't be looked at as any one particular disease if we really come down to it. And in terms of the preventability, some of the points that Amy's going to touch on today are going to be absolutely critical in order to help patients, steer away from that path of having this condition, the right type of diet and lifestyle with exercise and other activities that the healthcare team will talk about. And when it becomes necessary, medications can help patients, to at least live the healthiest life that they have possible.
And Amy, we're going to be taking a diabetes risk test a little later, but as Jennifer said, can diet and exercise really help manage diabetes or preventing diabetes?
Absolutely. I think that when you look at the spectrum of, like she was talking about, there's so many areas of the body that it affects, but when we think about it as a term to prevent and catch it in the pre-stage, diet and exercise are critical in lowering the risk factors for it. And so we'll talk in depth about diet and what it is that you should eat, because I think that's the most common question. What can I eat now, right? You've been given this diagnosis and now it's like you're set to go and you're not sure what to eat. Exercise really plays in on where, the insulin is not working properly in your body, and you're able to now help with the resistance and make that insulin work a little bit better. So it's kind of like a three-legged table is how I always explain it to people. And you have diet, exercise, and possibly then progressing to medication. But within the immediate beginning diagnosis, absolutely diet and exercise are critical in order to help control.